Question 1. During a measles outbreak, a public health nurse plans school-based interventions for a community with low MMR coverage. Which action best reflects community-level primary prevention? A. Conducting MMR vaccination clinics at schools. B. Arranging home visits for children with measles. C. Tracking exposed students for rash onset. D. Reviewing hospital records to analyze complications. Answer. A. Conducting MMR vaccination clinics at schools. Rationale. Primary prevention prevents disease before it occurs. On-site vaccination increases coverage and herd immunity. B is tertiary, managing existing illness. C is secondary, early detection/monitoring. D is evaluation/epidemiologic analysis, not prevention. Question 2. A nurse uses epidemiologic data to prioritize interventions for rising opioid overdoses in a rural county. Which first step demonstrates evidence-based population assessment? A. Implementing naloxone training for all residents. B. Calculating incidence and mapping hotspots by census tract. C. Distributing brochures on safe prescribing. D. Hosting a countywide town hall meeting. Answer. B. Calculating incidence and mapping hotspots by census tract. Rationale. Determining where and how often events occur, incidence plus geospatial mapping, targets limited resources effectively. A and C are interventions chosen after assessment. D is engagement, but not a rigorous analytic first step. Question 3. During a home visit, a community health nurse notes space heaters near drapes, no CO detector, and frayed wiring in a rental unit. Which action best aligns with environmental health and risk reduction? A. Teach fire extinguisher use only. B. Report the landlord to law enforcement. C. Initiate a referral to housing code enforcement and provide safety education. D. Advise immediate relocation without referral. Answer. C. Initiate a referral to housing code enforcement and provide safety education. Rationale. Combining system-level advocacy code enforcement with client education addresses upstream hazards. A is too narrow. B may be inappropriate. Code enforcement is the correct channel. D may be unrealistic and ignores structural remedies. Question 4. A nurse leading a disaster triage site must rapidly sort victims after a tornado. Which client is the priority for immediate red tag care? A. Adult with an open tibial fracture and stable respirations. B. Child with wheezing, RR 38 per minute, retracting, SpO2 86% on room air. C. Adult with minor lacerations, controlled bleeding, alert. D. Elderly person with bruises, ambulatory, oriented. Answer. B. Child with wheezing, RR 38 per minute, retracting, SpO2 86% on room air. Rationale. Airway/breathing compromise and hypoxemia require immediate intervention in start/jumpstart triage. A is delayed if perfusion/airway are stable. C and D are minor/green. Question 5. A public health nurse develops a culturally tailored diabetes prevention program for a migrant community with high pre-diabetes rates. What is the most effective first implementation step? A. Translate CDC handouts and mail them. B. Partner with community leaders to co-design sessions and food demos. C. Schedule weekly lectures at the clinic. D. Launch a social media campaign in English. Answer. B. Partner with community leaders to co-design sessions and food demos. Rationale. Community-based participatory approaches increase relevance, trust, and uptake. A and D lack cultural tailoring/engagement. C is didactic and less effective than co-created practical interventions. Question 6. A nurse manages a TB contact investigation after a positive smear in a crowded shelter. Which step is the correct sequence priority to prevent transmission? A. Screen close contacts with symptom review and IGRA. B. Start community education sessions about cough etiquette. C. Evaluate ventilation and implement respiratory controls at the shelter. D. Provide DOT for the index client's treatment. Answer: D. Provide DOT for the index client's treatment. Rationale: treating the infectious source index case with directly observed therapy promptly reduces transmission. Then screen contacts. A. Implement environmental/administrative controls. C. And reinforce education. B. Question 7. While reviewing immunization cold chain logs at a clinic, the nurse notes refrigerator excursions to 12 degrees Celsius for several hours. What is the best action? A. Continue using vaccines if they look normal. B. Quarantine affected vaccines and consult manufacturer/health authority guidance. C. Lower thermostat and proceed with administration. D. Discard all clinic vaccines immediately. Answer: B. Quarantine affected vaccines and consult manufacturer/health authority guidance. Rationale: temperature excursions require isolating stock and following stability guidance. Potency may be compromised. A and C risk administering ineffective vaccines. D may waste viable stock without verification. Question 8. A school nurse identifies clusters of absenteeism due to GI illness after a community fair. Which action best represents secondary prevention and surveillance? A. Inspecting food vendor permits for the next fair. B. Collecting line lists of cases, exposures, and onset times for health department reporting. C. Developing a hand-washing curriculum for future events. D. Posting general food safety tips on the school website. Answer: B. Collecting line lists of cases, exposures, and onset times for health department reporting. Rationale: case finding and systematic data collection enable timely outbreak confirmation and control. A and C are primary prevention for future risk. D is low-impact health promotion without surveillance value. Question 9. During a prenatal outreach visit, a nurse learns a client with limited resources is food insecure and missing prenatal vitamins. What is the priority nursing action? A. Teach fetal development stages. B. Refer to WIC/food assistance and supply prenatal vitamins immediately. C. Schedule a clinic tour for later engagement. D. Provide a breastfeeding pamphlet only. Answer: B. Refer to WIC/food assistance and supply prenatal vitamins immediately. Rationale: addressing immediate determinants, nutrition/micronutrients, reduces risk for adverse outcomes, connect to resources, and provide supplements now. A, C, and D are helpful, but not the immediate priority. Question 10. A community nurse is mediating a conflict between local leaders and a mobile clinic over syringe services. Which statement best uses harm reduction and ethical principles to build consensus? A. This program encourages drug use but keeps it hidden. B. We will stop services if anyone objects strongly. C. Syringe services reduce infections and connect people to treatment while protecting the whole community. D. Law enforcement will manage all concerns about use. Answer: C. Syringe services reduce infections and connect people to treatment while protecting the whole community. Rationale: harm reduction is evidence-based, decreases HIV/HCV, and serves both individuals and community health. It maintains dignity and links to care. A is incorrect and stigmatizing. B abdicates public health responsibility. D shifts responsibility without addressing health outcomes or collaboration. Question 11. A community nurse is developing a program to reduce maternal mortality in a low-resource rural area. Which initial step ensures the most effective use of limited resources? A. Launching a social media campaign on safe motherhood. B. Conducting a community needs assessment and stakeholder interviews. C. Distributing free prenatal vitamins to all women. D. Training nurses in advanced obstetric care immediately. Answer: B. Conducting a community needs assessment and stakeholder interviews. Rationale. Assessing needs ensures interventions address the community's specific causes of maternal mortality. A and C are interventions chosen later. D may be valuable, but should follow assessment to target skills effectively. Question 12. A nurse is managing a vaccination campaign in an area with vaccine hesitancy. Which strategy best promotes acceptance while respecting autonomy? A. Mandating vaccination through local enforcement. B. Providing clear, culturally tailored education and addressing concerns in open forums. C. Dismissing families who decline from care. D. Limiting vaccines only to those who request. Answer. B. Providing clear, culturally tailored education and addressing concerns in open forums. Rationale. Respectful, evidence-based engagement fosters trust and informed choice. A and C are coercive, violating autonomy. D. Underutilizes public health opportunity. Question 13. A nurse is conducting surveillance for West Nile virus after increased mosquito activity. Which action demonstrates active surveillance? A. Reviewing hospital discharge data weekly. B. Contacting clinics to obtain new suspected case reports. C. Waiting for labs to notify the health department. D. Publishing seasonal reminders for providers. Answer. B. Contacting clinics to obtain new suspected case reports. Rationale. Active surveillance requires proactively seeking cases. A and C are passive surveillance. D is health promotion, not surveillance. Question 14. After a flood, a nurse prioritizes interventions for displaced families in a shelter. Which action is the highest priority for preventing disease spread? A. Providing mental health counseling services. B. Ensuring access to safe drinking water and sanitation facilities. C. Organizing vaccination campaigns for tetanus and influenza. D. Conducting recreational activities for children. Answer. B. Ensuring access to safe drinking water and sanitation facilities. Rationale. Water and sanitation prevent outbreaks of diarrheal and vector-borne diseases, the most immediate risk in disasters. Vaccination, C, and mental health, A, are important but secondary. D addresses psychosocial needs, not survival-critical risks. Question 15. A community health nurse identifies a high rate of uncontrolled hypertension in a neighborhood. Which strategy reflects tertiary prevention? A. Conducting community-wide blood pressure screening. B. Implementing exercise and nutrition workshops. C. Referring clients with hypertension to chronic disease self-management programs. D. Launching a smoking prevention campaign in schools. Answer. C. Referring clients with hypertension to chronic disease self-management programs. Rationale. Tertiary prevention manages and reduces complications in diagnosed cases. A is secondary prevention. B and D are primary. Question 16. A nurse in occupational health notices frequent respiratory complaints among factory workers. What is the priority action? A. Encourage workers to wear personal protective equipment. B. Report findings to OSHA and initiate a workplace hazard assessment. C. Distribute cough suppressants to symptomatic workers. D. Provide education on smoking cessation. Answer. B. Report findings to OSHA and initiate a workplace hazard assessment. Rationale. Addressing root causes environmental exposure protects all workers. A is short-term and less effective than system-level intervention. C is symptomatic treatment only. D may help long-term, but doesn't address workplace hazard. Question 17. A nurse is preparing a community disaster plan for a coastal town prone to hurricanes. Which component is most critical to include first? A. Pre-identification of evacuation routes and transportation for vulnerable populations. B. Developing long-term housing solutions. C. Providing training on hurricane history and trivia. D. Establishing annual community fairs to raise awareness. Answer: A. Pre-identification of evacuation routes and transportation for vulnerable populations. Rationale: evacuation planning for at-risk groups, elderly, disabled, low income, is critical for immediate disaster survival. Housing B is post-disaster recovery. C and D are less critical for safety. Question 18. A nurse suspects lead poisoning risk in children living in old housing units. Which action reflects primary prevention? A. Testing children's blood lead levels. B. Referring children with elevated levels to chelation therapy. C. Educating parents about wet cleaning techniques and nutrition to reduce exposure. D. Developing a follow-up registry for exposed children. Answer: C. Educating parents about wet cleaning techniques and nutrition to reduce exposure. Rationale: primary prevention prevents exposure before harm occurs. A is secondary screening. B is tertiary treatment. D is surveillance, not prevention. Question 19. A nurse leading a community coalition must decide between funding a mobile clinic for chronic disease or a violence prevention program. Which ethical principle guides choosing the intervention with the greatest community impact? A. Fidelity. B. Justice. C. Autonomy. D. Beneficence. Answer: B. Justice. Rationale: justice involves fair distribution of resources to maximize equity and impact. Fidelity, loyalty, relates to keeping promises. Autonomy applies to individual choice. Beneficence is doing good, but less specific to equitable allocation. Question 20. A nurse manager in a free clinic notes high no-show rates among uninsured patients with diabetes. Which strategy best addresses the barrier? A. Implementing telehealth visits with evening hours. B. Increasing the number of appointment reminders only. C. Discharging clients who repeatedly miss visits. D. Providing patient education about diabetes complications only. Answer: A. Implementing telehealth visits with evening hours. Rationale: flexibility in access, telehealth, off hours, addresses structural barriers. B. Improves reminders but not access. C is punitive. D is educational but does not solve access problems. Question 21. A community health nurse is working with refugees recently resettled. Which priority intervention addresses immediate health needs? A. Offering counseling about cultural adjustment. B. Providing immunizations and communicable disease screening. C. Organizing employment assistance programs. D. Teaching English language classes. Answer: B. Providing immunizations and communicable disease screening. Rationale: infectious disease risk is high post-resettlement. Immunization/screening prevent outbreaks. A, C, D are important but not immediate health priorities. Question 22. During a pandemic, a nurse must allocate scarce ventilators. Which framework supports the most ethical decision-making? A. First come, first served basis. B. Allocation based on ability to pay. C. Prioritizing patients with the greatest chance of survival and recovery. D. Giving preference to influential community leaders. Answer: C. Prioritizing patients with the greatest chance of survival and recovery. Rationale: ethical frameworks in public health prioritize maximizing survival and outcomes. A is inefficient. B violates equity. D is unjust and not evidence-based. Question 23. A school nurse notes an increase in adolescent vaping. Which intervention reflects the best population-based strategy? A. Conduct one-on-one counseling with individual students. B. Implement a school-wide peer education and anti-vaping campaign. C. Provide nicotine replacement therapy to addicted students only. D. Notify parents about suspected student use. Answer: B. Implement a school-wide peer education and anti-vaping campaign. Rationale: peer-led, school-wide interventions address population health and prevention. A and C are individual level, not broad. D may alienate students and reduce trust. Question 24. A nurse identifies a high suicide rate in LGBTQ+ youth. Which nursing intervention best addresses social determinants of health? A. Increase crisis hotline advertisements. B. Advocate for inclusive school policies and anti-bullying enforcement. C. Provide counseling sessions for individuals. D. Distribute pamphlets on suicide warning signs. Answer: B. Advocate for inclusive school policies and anti-bullying enforcement. Rationale: upstream advocacy reduces stigma and systemic risk factors. A and C provide support but don't address root causes. D is passive and insufficient. Question 25. A public health nurse is evaluating a smoking cessation program. Which measure best demonstrates program effectiveness? A. Number of flyers distributed in the community. B. Percentage reduction in smoking rates among program participants at 12 months. C. Number of people who attended the first session. D. Number of community volunteers trained. Answer: B. Percentage reduction in smoking rates among program participants at 12 months. Rationale: outcome evaluation focuses on measurable health changes. A, C, and D are process measures, not effectiveness outcomes. Question 26. A nurse is developing a community program to address rising rates of multi-drug resistant TB. Which intervention best addresses both treatment success and prevention of spread? A. Provide DOT, directly observed therapy, and case management support. B. Give pamphlets about TB symptoms to the community. C. Focus only on screening high-risk contacts. D. Educate families on nutrition to strengthen immunity. Answer: A. Provide DOT, directly observed therapy, and case management support. Rationale: DOT ensures adherence, prevents resistance, and protects the community. Pamphlets and education alone do not guarantee adherence. Screening is important, but not sufficient without treatment adherence. Question 27. During a chemical plant explosion, the community nurse must triage clients. Which patient should be treated first according to disaster protocols? A. Client with severe burns over 80% of body surface area. B. Client with open femur fracture but stable airway. C. Client with respiratory distress and wheezing after inhalation exposure. D. Client with minor abrasions and oriented X4. Answer: C. Client with respiratory distress and wheezing after inhalation exposure. Rationale: airway compromise is immediate priority. Burns with poor survival are expectant. Open fracture is delayed if stable. Abrasions are minor. Question 28. A nurse is conducting a windshield survey and notices a lack of grocery stores but multiple fast food outlets. Which nursing diagnosis best applies to this finding? A. Risk for ineffective coping. B. Imbalanced nutrition, more than body requirements. C. Deficient knowledge, food safety. D. Risk for impaired parenting. Answer: B. Imbalanced nutrition, more than body requirements. Rationale: limited access to healthy foods increases risk of obesity and poor nutrition. A, C, and D are unrelated to the environmental observation. Question 29. A rural clinic has high rates of vaccine-preventable diseases due to limited access. What is the nurse's most effective advocacy action? A. Request funding for mobile immunization clinics. B. Provide vaccination brochures to families. C. Encourage clients to travel to the nearest urban hospital. D. Recommend families buy private insurance. Answer: A. Request funding for mobile immunization clinics. Rationale: mobile clinics directly address geographic access barriers. Brochures and recommendations don't solve access. Insurance won't fix systemic access barriers. Question 30. During contact tracing of a meningococcal outbreak, which step must the community nurse prioritize? A. Teach community about hand hygiene. B. Provide immediate prophylactic antibiotics to close contacts. C. Collect data on long-term complications. D. Host an educational seminar at schools. Answer. B. Provide immediate prophylactic antibiotics to close contacts. Rationale. Secondary prevention chemoprophylaxis is essential to stop spread. Education and long-term data are important but not urgent. Question 31. A community nurse is developing a suicide prevention program for adolescents. Which evidence-based approach is most effective? A. Individual counseling for identified at-risk students only. B. Peer-led school-wide programs that promote resilience and connectedness. C. Mandatory daily mental health screenings for all students. D. Distribution of informational pamphlets. Answer. B. Peer-led school-wide programs that promote resilience and connectedness. Rationale. Population-based, peer-driven interventions build protective factors and reach more youth. A and C are resource-intensive and less feasible. Pamphlets are low impact. Question 32. A nurse identifies elevated asthma rates among children near an industrial zone. What is the most critical upstream intervention? A. Provide individual inhaler education to families. B. Advocate for stricter air quality regulations and monitoring. C. Teach school staff how to respond to asthma attacks. D. Screen children annually for asthma symptoms. Answer. B. Advocate for stricter air quality regulations and monitoring. Rationale. Upstream advocacy addresses the root cause air pollution. A, C, and D are downstream interventions. Question 33. While implementing a community health program, the nurse must allocate limited funds. Which principle should guide resource distribution? A. Favoring groups with the most political influence. B. Prioritizing interventions that improve equity for the most vulnerable populations. C. Supporting only clients who demonstrate compliance. D. Dividing funds equally across all groups. Answer. B. Prioritizing interventions that improve equity for the most vulnerable populations. Rationale. Equity ensures fair distribution of resources to those with greatest need. Political influence, compliance, and equal division may worsen disparities. Question 34. A nurse is asked to evaluate a new needle exchange program. Which indicator best measures the program's effectiveness? A. Number of clean syringes distributed. B. Percentage reduction in new HIV and hepatitis C infections. C. Number of participants who attended orientation. D. Amount of funding received. Answer. B. Percentage reduction in new HIV and hepatitis C infections. Rationale. Effectiveness is measured by health outcomes, not just outputs or process indicators. Question 35. After a wildfire, a nurse assesses displaced families in a shelter. Which finding requires the most immediate intervention? A. Client with anxiety and insomnia. B. Child with fever, cough, and respiratory distress. C. Adult requesting information about insurance paperwork. D. Elderly client reporting mild joint pain. Answer. B. Child with fever, cough, and respiratory distress. Rationale. Possible pneumonia or acute illness in a shelter can spread rapidly and compromise life. Others are important but less urgent. Question 36. A nurse leader must decide between expanding mental health services or dental care in a low-income area. Which decision-making tool ensures transparency and fairness? A. Cost-benefit analysis with stakeholder engagement. B. Manager's individual clinical judgment. C. Prioritization based on which service is easier to implement. D. Random selection of programs. Answer: A cost-benefit analysis with stakeholder engagement. Rationale: structured analysis plus input ensures ethical, transparent allocation. Other methods lack fairness and evidence-based decision-making. Question 37. A nurse identifies high teen pregnancy rates in a community. Which intervention best demonstrates secondary prevention? A. Providing contraceptives and sexual education classes. B. Referring pregnant teens to prenatal care clinics. C. Advocating for school policy change to support teen parents. D. Offering after-school mentorship programs. Answer: B. Referring pregnant teens to prenatal care clinics. Rationale: secondary prevention equals early detection/intervention in existing conditions. A and D are primary prevention. C is tertiary, support after pregnancy. Question 38. A nurse is planning a global health mission in a country with high infant mortality. Which intervention reflects the most effective, evidence-based strategy? A. Promote breastfeeding and train birth attendants in neonatal resuscitation. B. Offer routine full-body CT scans for infants. C. Distribute vitamins only to infants who present to the hospital. D. Provide health education pamphlets in English only. Answer: A. Promote breastfeeding and train birth attendants in neonatal resuscitation. Rationale: evidence shows breastfeeding and skilled birth attendants reduce infant mortality. CT scans and pamphlets are unrealistic. Vitamin distribution only at hospitals misses most. Question 39. A nurse conducting a community forum on climate change identifies residents worried about heat waves. Which intervention best demonstrates community-level adaptation? A. Advising individuals to drink water at home. B. Developing community cooling centers with transportation support. C. Recommending sunscreen use daily. D. Encouraging residents to purchase personal air conditioning units. Answer: B. Developing community cooling centers with transportation support. Rationale: community-level, equitable strategies protect vulnerable populations during heat waves. A and C are individual level. D is not feasible for all residents. Question 40. A public health nurse is advocating for policy to reduce opioid overdoses. Which proposal demonstrates an upstream, population-focused approach? A. Expanding medication-assisted treatment programs and naloxone availability. B. Increasing ER staffing for overdose patients. C. Encouraging patients to taper opioids only after dependence develops. D. Training nurses to manage acute withdrawal symptoms. Answer: A. Expanding medication-assisted treatment programs and naloxone availability. Rationale: MAT and naloxone reduce population-level mortality. ER staffing and withdrawal training are reactive. Tapering only after dependence is too late. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.